Welcome back. Our next guest is Dr. Hans Otto with Family Allergy and Asthma. Dr. Otto, welcome to our program.
Thank you very much for having me.
Well, thank you for being here. Why don't you tell us a little bit about yourself and your company?
Well, Family Allergy and Asthma was founded in 1979 by Drs. Pollard and Dr. Sublett. They started off in the Louisville area and then have spread to the Kentucky and Indiana area. We're now the 19th office with 14 physicians and 5 nurse practitioners in the practice. Our goal is to bring medicine and allergy care to the underserved areas. The Northern Kentucky market has over 500,000 patients and only 3 other fellowship-trained board-certified allergists.
That's a great goal. Sounds like you have a fantastic practice. How long have you been with the practice, Dr. Otto?
I joined in July of 2011. I came from the U.S. Air Force, where I served a number of different roles, but most recently was as Chief of Allergy Immunology at Wright-Patterson Air Force Base. While there, I was also Assistant Professor of Medicine at Wright State University, as well as Assistant Professor of Medicine for the Uniformed Services University of Health Sciences, which is the military's medical school.
Great.
Bethesda.
Now, we're at the time of the year with the fall where so many people feel like they have allergies or asthma or colds or something. How do people distinguish whether what they have is allergy or cold?
Well, it can be very difficult. There's no one symptom that differentiates between allergies and a cold, except maybe a fever that's verified by a thermometer. Both colds and allergies can have runny nose, sniffly sneezing, itchy throat. But we can determine those things by a history, a physical, and by skin testing in our clinic.
Okay. Now, our viewers are watching some fascinating things. Right now they're seeing pictures of people getting pin testing. Why don't you tell us a little bit about that? I think that's somebody that may suspect they have an allergy.
So skin prick testing or scratch testing is probably the most practical, easiest, and quickest way to get a good answer as to what things you might be allergic to, both in your environment and those things that are surrounding and pollinating you different times of the year.
Okay. Now, if you discover that I do have an allergy, how do you treat it?
Well, the first thing that we always talk about is avoidance. Avoidance as best as you're able, or as best as the environment will allow us. We also have the ability to utilize a number of different medications that are out there. And then a tool that's unique to our toolkit as allergists is immunotherapy or allergy shots, where we actually take what you're allergic to and we put them in a series of vials and slowly desensitize you to those allergens. So we teach your body to stop recognizing those things as foreign and start recognizing them as tolerable.
Okay, that's an amazing field. I find the whole thing very fascinating. It sounds like it's come a long way over the past several years as well.
I love doing it and am able to give patients a lot of relief in regards to their allergies and their asthma and other allergic diseases.
Great. Well, Dr. Otto, how can our viewers get a hold of you and get a hold of Family Allergy and Asthma?
Well, they can certainly check us out on our website or give us a call directly at 859-980-7180.
Great. Dr. Otto, wonderful service that you and your company provide, and we appreciate you being part of the program today.
Thank you very much for having me.
We'll be back in just a few minutes with our final segment.